Is ketamine the new cure for depression? You might be thinking, wait a minute, are you talking about Special K? Or no, it's those horse tranquilizers, right? Yikes! What the heck does that have to do with my depression? And how in the world would it help me anyway? Today I'm going to be busting some myths and also diving deeper into these questions. Hi there. If you're new here, welcome. My name is Raquel Perez, and I am a licensed therapist in the state of Colorado. One of my areas of specialization is ketamine therapy, and this channel is where I share therapy tools and resources. If that sounds like something that you are looking for, please subscribe to the channel down below. With that, let's go ahead and dive into today's topic. Ketamine has gained some significant attention when it comes to being a novel treatment for depression, especially when it comes to treatment-resistant depression, or TRD. But before it gained all of this popularity in the mental health field, it first was introduced into medicine and then later repurposed for mental health purposes. We're going to take a deeper dive into the origins into medicine and then further how it was repurposed. Ketamine was first synthesized in the 1960s by Dr. Kelvin Stevens while he was working at a pharmaceutical company, and their aim was to gain safer anesthetics. But it wasn't for another decade, in the 1970s, that it was introduced into medicine as an anesthetic, primarily for surgeries. Ketamine offered many advantages than other of the anesthetics that were available at the time. First, it offered a rapid onset of action, being effective only minutes after administration. Secondly, it's known as a dissociative anesthetic. It allows the patient to become unaware of their surroundings while still maintaining vital functions like heart rate and respiration. And thirdly, for its safety. It has a high therapeutic index, which means it has a very low risk for overdose. And this makes it particularly beneficial for situations like emergencies and the battlefield. As you can imagine, these benefits made ketamine very useful when it came to surgical settings. Its dissociative properties made it especially useful in emergencies and also the military, like Vietnam, because it induced amnesia, it was very easy to administer, and it maintained cardiovascular function. And unlike many other anesthetics, it didn't impede respiratory function, which made it very useful when working with patients where their own breathing was especially important to maintain. And just as all of these properties made ketamine very useful to use in humans, it also became very useful to use in animals as well. So it became very popular in veterinarian medicine. It's very versatile, working on very, very small animals like cats and dogs, all the way up to bigger animals like, yes, horses. It can also be used in emergency settings like surgeries, but it can also be used to help with chronic pain. So because of its versatility, it has become very popular and really a go-to medicine in veterinarian settings. Since it's much easier to gain access to this medicine at a veterinarian setting than it is at a human setting, like a hospital, that means that oftentimes ketamine would be taken from veterinarian settings to be used recreationally. Thus, it became known as the horse tranquilizer, and oftentimes in recreational settings, it's also called Special K. Now, you might be wondering, okay, but how in the world did ketamine go from anesthesia in surgery rooms and vet hospitals into my therapy office? And that's a good question. There were some unexpected discoveries made in the 1990s when surgeons began noticing that after surgery, when ketamine was administered to the patient seemed to recover from surgery and have an overall better mood, even in those with pre-existing depression. So naturally, this led to research being done for the antidepressant properties of ketamine. And it was actually uncovered that it was very, very beneficial when it came to the treatment of depression, especially in individuals who had not responded well to traditional treatments. Now you might be asking, okay, but how does it actually work? And that's a valid question. Well, unlike traditional treatment for depression, like SSRIs or selective serotonin reuptake inhibitors, which act on serotonin, norepinephrine, and dopamine, ketamine acts on the glutamate system. Specifically, it acts as an NMDA receptor antagonist, which means it blocks this receptor. And NMDA is a type of glutamate receptor. And this blockade on the NMDA receptor allows more glutamate to be released out of the cell. It also activates AMPA receptors in the cell. And all of this leads to the promotion of synaptic plasticity and neuroplasticity, which is believed to reverse the structural changes in the brain associated with depression. Now, if you're wondering, what the heck does all that mean? Don't worry, I got you. We're going to geek out a little bit and take a deeper look into the science behind how ketamine is helping at a cellular level for depression. When you take ketamine, it occupies the space of the NMDA receptor in the cell. So then when GABA shows up, which is an inhibitory neurotransmitter, it is blocked because ketamine is in its place, and this allows more glutamate to be released. Now, if we look at this entire process and the increase of glutamate, the glutamate activates the AMPA receptor. And an activated AMPA receptor is the foundation for synaptic plasticity, which allows your brain to make new connections that reflect new learning. For example, if you're learning a new skill or are exposed to a new experience, over time, these strengthened connections become the foundation for neuroplasticity as the brain adapts and rewires itself in repurpose to new information or injury recovery. Oh, but that's not all ketamine does. Let's take a look at this next action. Remember how we talked about how ketamine allows more glutamate to be released from the cell? Well, that increased glutamate also can bind in a later process and increase BDNF protein to be released from the cell. And BDNF directly increases new dendritic connections, aka new cell connections. Imagine those new connections happening all over your brain simultaneously. Well, my friend, that is the making of much emotional healing and brain restoration, leading to reduced depression symptoms. How cool is that? It can feel so frustrating when your depression symptoms are not responding to medications like SSRIs. And if this is the case for you, you're not alone. It's estimated that 30% of individuals have symptoms that do not respond to traditional treatments like SSRIs, and they continue to suffer from debilitating depression symptoms. This has led to research for other treatment options, and ketamine has surfaced as a groundbreaking treatment, especially for those who their symptoms have not responded well to other treatments. One of the most striking features of ketamine is its rapid onset of relief. Whereas other traditional medications like SSRIs can take weeks to show effectiveness, ketamine can start to show decreased symptoms in as little as days or even hours sometimes. This rapid relief can be especially important for individuals who are experiencing acute depression or suicidal ideation, as it offers immediate stabilization, while other treatment offers can be explored. Now, lastly, I really feel like I need to explain how ketamine and talk therapy work so well together. And there is strong evidence to suggest that the most effective approach is to combine ketamine therapy with talk therapy. Research from Johns Hopkins showed that individuals who received ketamine therapy in combination with talk therapy maintained a significant improvement on their symptoms 6 weeks after treatment, when compared to those who only received ketamine as treatment. Another study published in the Lancet Psychiatry in 2021 showed that 66% of patients who received 6 sessions of combined ketamine with talk therapy had a marked reduction in depressive symptoms, with many of them maintaining improved outcomes for months after the study concluded. Combining ketamine therapy with talk therapy has shown to be a highly effective treatment for treatment-resistant depression. And the key benefits include 1. Rapid reduction in symptoms, allowing the patients to engage more fully in the therapeutic process. 2. Sustained improvement in mental health symptoms over time, especially when therapy continues alongside ketamine therapy. And 3. Higher patient satisfaction and engagement, as patients report deeper emotional connections and more meaningful insights during therapy. Well, my friend, that is all I have for this video today. If you have found it useful or helpful in any way, please hit that like button down below. If you are looking for more content like it on a weekly basis, please subscribe to the channel. And don't forget to check out the description below to download your free tool today, which is a guide to creating your own safe space for insight. Well, my friend, I will leave you with this affirmation meditation for depression symptoms. And until next time, bye for now.